Our daily agenda in life is not to get ahead of others, but to get ahead of ourselves, to break our oracles and to strip our yesterday, our today, and to do our work with more force than ever before. Welcome to the Royal News.
CDC Coronavirus 2019. The disease is common throughout the world. It can infect people and animals. What are the causes of coronavirus?
The causes of coronavirus is the family of viruses that can cause illnesses, e.g. the common cold, the severe headache, and short breath. Even though the cure has not been found, it's well known that many people are now aware since it has been declared as a global disease. Therefore, it's required that everyone to be on the watch and to take care of oneself since the disease is highly contagious. And what are the spread of the disease?
What are
symptoms of the disease?
The presence of the virus lasts between 2 to 14 days to expose the infected, fever, cough, shortness of breath. What are the spread of the disease?
The spread of the disease include close contact with people, those are infected people, like within 6 feet, respiratory droplet, that is cough, and sneezes touching the infected object or surfaces. And those who are not sick may not spread the disease. And what are the prevention and treatment?
There is currently no vaccine to prevent coronavirus disease 2019. This is COVID-19. The best way to prevent illness is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help the spread of respiratory disease, including avoid close contact with people who are infected, avoid touching your eyes and nose and mouth, stay home when you are sick, cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe.
Follow CDC's recommendation for using a face mask. CDC does not recommend that people who are well to wear the face mask to protect themselves from respiratory diseases, including the coronavirus. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers and people who are taking care of the infected one in close settings, that is at home or healthcare facilities.
Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Also wash your hands with soap and water if hands are visibly dirty. For information about the hand washing, see CDC's hand washing website. For information specific to healthcare, see CDC's hand hygiene in healthcare settings.
The treatment. There is no specific treatment and the antiviral treatment recommended for COVID-19. People with COVID-19 should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support viral organs function. And the researchers had tried to use antiviral as well as 4 antibiotics that treat staph and skin infection in the lab test, but not highly contagious diseases.
For our sources, we have reported that WHO doesn't recommend that there is a cure for the virus. We are using mass media to create awareness to the globe since prevention is better than cure.
Until next time, thanks.